Hello everyone and welcome. I'm Faculty A. Today we're going to unpack a silent epidemic that claims thousands of lives in India every year. It's the snakebite crisis, a really crucial topic for your GS Paper 3. You know, it's often called a neglected tropical disease, and understanding these kinds of complex issues is exactly what the mains exam is all about.
So, where are we getting this from? Well, our discussion today is based on this recent and very insightful article from The Hindu. We're going to break down its main points to really get a handle on the scale of this health challenge, the huge gaps in how we respond, and, well, the promising solutions that technology might just offer.
And I'm Faculty B. So, how are we going to break this down for you? We've structured our discussion into 5 key parts to give you a really clear picture. We'll start with what's happening on the ground in Kerala, then we'll get into the core problem with diagnosis, look at the treatment itself, and then, of course, explore the path forward. This structure should really help you build a solid, well-rounded answer.
All right, let's dive right in with a real-world example. The article really shines a light on Kerala, where an unusually hot summer is literally pushing snakes into places where people live. You add to that their pre-monsoon breeding season, and you've got a perfect storm for more human-snake encounters. This is a direct link between changing climate patterns and human-animal conflict.
Exactly. And you know, while Kerala is our case study, this isn't just a Kerala story. This is an all-India story. Just look at this number. About 50%. India tragically accounts for nearly half of all snakebite deaths in the world. That single statistic right there takes this from a local issue to a massive national public health emergency. A really powerful point to start an exam answer with.
So, this brings us to the absolute heart of the crisis, what we're calling the diagnostic dilemma. You have to put yourself in the shoes of a doctor in a rural clinic. The first challenge isn't just how to treat the bite, it's whether to treat it at all.
And here is the core of that dilemma. The way we do things now is totally reactive. Doctors have to wait for symptoms to show up, like nerve damage or blood clotting problems. But the issue is, by then, the venom might have already done irreversible damage. Now here's the paradox. About 70% of snake bites are actually dry bites, meaning no venom was injected. So giving treatment in those cases isn't just a waste, it's actually dangerous.
Now, this reactive wait-and-see method, it has a name, and it's a key term you should absolutely know, the syndromic approach. It means you're diagnosing based only on the symptoms you can see. And look, it's not just us saying this is a problem. The Indian Council of Medical Research, the ICMR, has officially called it a systemic flaw. Quoting a major body like ICMR in your answer gives it so much more weight.
So this flawed diagnosis leads us straight into our third section, the problem with the cure itself. The one and only effective treatment for a venomous snakebite is anti-snake venom, or ASV. It absolutely saves lives. The problem is, when it's used without certainty, it creates a whole new cascade of serious issues. And you can see how the consequences just pile up. Giving anti-snake venom when it's not needed can trigger a severe allergic reaction, sometimes even fatal anaphylaxis, which is a life-threatening shock. And it doesn't stop there. Every single ASV administration protocol requires an ICU bed, a ventilator on standby, and specially trained staff. Imagine the strain this puts on our rural healthcare centers, which are already struggling with resources.
So it's pretty clear we need a much smarter way to handle this. And this is where we pivot to the solution, which really lies in science and technology. We have to shift from this symptom-based guesswork to an evidence-based approach.
So what does a better process look like? Just imagine this for a second. A patient arrives at a clinic. A single drop of blood is put on a rapid diagnostic kit, and within minutes, boom, you get a clear yes or no for the presence of venom. Only then is the ASV given, but now it's given with complete confidence. This kind of technology takes out all the guesswork. It saves lives, and it frees up those precious hospital resources. Highlighting indigenous R&D here is absolutely key for your answer.
But look, technology is a huge part of the answer, but it's not a silver bullet. It has to be paired with smart policy and public awareness. And Kerala actually gives us some fantastic examples here. Their SARPA app and Pradam scheme help to professionalize snake rescues, while the Suraksha campaigns educate kids right in their schools. These are excellent, concrete policy examples you can cite to show you're thinking about a multi-pronged solution.
Okay, let's tie this all together now and think specifically about the exam. How can you take these ideas and structure them for GS Paper 3? You have to remember, a core theme in that syllabus is applying science and technology to solve major public health challenges, and this is a perfect textbook case study for it.
And you might get a question that looks something exactly like this one. Discuss the role of indigenous technology in addressing India's public health challenges, using the example of snakebite management. A question like this is asking you to pull together all the points we've just talked about into a sharp, coherent answer. Here's a simple framework to help you structure that answer. In your introduction, define snakebite as a neglected tropical disease and hit them with that high-burden statistic for India. Then, for the main body, first lay out the challenges. Talk about the syndromic approach, the ASV risks, the infrastructure gaps. Then you pivot to the solutions, the role of R&D in diagnostics, policy moves like SARPA, and finally, for your conclusion, just tie it all up by calling for a multi-pronged approach. A clear structure like this is really the key to a high-scoring answer.
And finally, let's leave you with a question that goes beyond the mains paper and right into the interview room. As a future administrator, what's the real challenge here? Is it developing the perfect, low-cost diagnostic kit, or is it the last-mile delivery? Getting that kit to thousands of villages, training the health workers, and actually making it part of the system? That's the kind of implementation challenge you will face on the ground. Something to think about. All the very best.